Welcome back. If you're a parent or a grandparent, a report that just came out of the White House last week should scare the daylights out of you because parts of it read about like a Stephen King novel. I'm talking about the MAHA report. I call it the MOCHA report because it's subtitled Making Our Children Healthy Again. Now, at 72 pages and a lot of it fine print, it's a load to get through. So in this video, I want to take you through the report, hit the highlights, and I want to talk about what we today can do as parents and grandparents to improve the future of our children. You're not going to like everything that I say. And that's okay as long as I help you think about things. And if you want to be a part of these conversations going forward, I'm asking you, please hit the like button, hit the subscribe button, and share this video with friends and family who love their kids too. If you have a point you'd like to raise or you have a question you'd like answered, drop it in the comments. If you're not interested in putting it out there in the public through the comments, send me an email. I have an email account specifically to handle questions from audience members like you. It's askcmodrjoe@gmail.com. The first thing that really scared the heck out of me is that it's apparent that we're failing our kids. Nearly half of American kids have chronic illnesses, including obesity, autism, allergies, mental health disorders, and frighteningly, pediatric cancers are on the rise. This should be a giant wake-up call for all of us. Our modern lifestyle, with readily available processed and hyper-processed foods, our sedentary lifestyle, where we're just not out and about as much as we used to, it's just failing our kids. It's not a healthy environment. So we need to take steps to overcome the food issues, to overcome the sedentary issues. We need to create a healthier food supply. We need to address the social isolation that comes along with us being couch potatoes, but has also been hugely exacerbated in our response to how we responded to COVID. So we need to get on these now. Right now, our youngest generation is our sickest generation. So time to get off the couch and act today. We can't reverse time, but we can reverse course. And I hope you'll agree with me by the end of this video, we have to. So Secretary Kennedy's team identified 4 primary drivers of why our next generation is our sickest generation. Number 1 is the food supply. Again, we rely too much on processed, hyper-processed, ultra-processed food. Do you know ultra-processed food now accounts for 70% of all calories that our kids consume? 70%. Does that seem right? And you know, the problem is that particularly with factory farming, more and more food has pesticides, antibiotics, genetically modified ingredients. You know, in the US food chain, manufacturers are the only ones who certify that their ingredients in their foods are safe. We deploy what's called GRAS, G-R-A-S, generally regarded as safe. And it's a self-reporting mechanism. As a result, we have over 10,000 approved ingredients that are going into our food chain. In Europe, they have an organized regulatory structure where ingredients need to be approved based on science. 100 ingredients. So again, 400, 10,000. Maybe there's a number in between there that makes better sense for us, but it should give you an indication of how out of control we have let our diet go. The second item on their list of 4 culprits is the environment. And again, it goes back to the chemicals and the food dyes and the pesticides. And we'll have lots to talk about that later. The third is the lack of physical activity. This sedentary lifestyle where screen time becomes almost all the time. When I was a kid, I'd get home from school, I'd drop off my book bag, and I would strip off that Catholic school uniform, and my mom couldn't wait to get me out of the house, running around with the kids in the neighborhood. And you know, it wasn't only just the physical activity that helped me, but I was learning how to socialize with others. I was learning with my coaches how to interact with authority figures. Those are life skills that I continue to use today. The fourth culprit that they identified was a little bit of a surprise for me. They referred to it as the overmedicalization of our youth. What's that mean? Well, first of all, kids are being prescribed medications at a rate that we've never seen before in the pediatric community. And then there's been an extraordinary explosion of how many vaccines and how many doses are being recommended. These all factor in to be developing a generation that is more chronically ill than ever before. You want proof? 75% of youths between the ages of 17 and 24 cannot qualify for military service. They can't even be sent to basic training. Not that they failed out of basic training, they don't even qualify to get in the door. Why? Allergies, autoimmune disorders, behavioral disorders, obesity, overweight, drug use, and drug abuse. You know, one of my heroes, as you know, is the FDA Commissioner, Dr. Marty Makary. He's a cancer surgeon from Hopkins and a ton of common sense. Marty Makary said, quote, "We now have the most obese, depressed, disabled, medicated population in the history of the world, and we cannot keep going down that same road." If you can argue with that logic, please put it in the comments. I just don't see how any parent or grandparent can find fault with what Dr. Makary's saying. It's really frightening, this burst of diagnoses, diseases, illnesses, conditions that our kids are being plagued by. I want to share this graphic, and it's from Fox News. But take a look at this because it should bring tears to your eyes. Look at the spike in diagnosing autism and autistic spectrum disorders. You know, a generation or two back, autism affected 1 in 10,000. That is now 1 in 31. So do the math. We've gone from 1 in 10,000 a couple of generations ago to 300 in 10,000. Something's wrong. ADHD. Nearly 1 in 8 kids are on medication today for ADHD. Pediatric cancer is up 40%. You know, I happen to be friends with Dick Vitale, the ESPN announcer. It's awesome, baby, that dude. Dick, God bless him, and his wife Lorraine, she's phenomenal. They have raised over $105 million in support of pediatric cancer research. How can we, as parents and grandparents, be part of the problem that's causing a 40% spike in pediatric cancers and not be part of the solution like Dick and Lorraine? Obesity, 20% of our kids are considered obese. Many more are considered overweight. Anxiety and depression has doubled. And we saw a big spike around the COVID diagnosis because we were socially isolating kids, keeping them out of classrooms. Food allergies are up over 25%. And did you know that peanut allergies have gone up threefold since 2000? Autoimmune disorders like celiac, which affects the gut. This one blows you away. Isn't arthritis an issue for old people? Not anymore. It's an autoimmune disorder that we are seeing increasingly causing juvenile arthritis. Sleep disorders are impacting 30% of kids. Most adults I know have had sleep disruptions, mostly stress related. Should kids be having disruptions to their sleep? 30% report the answer is yes. And frighteningly, pediatricians, both locally and across the country, are seeing frightening increases in the delay of speech in toddlers and other developmental milestone delays. So we're doing something wrong, folks, and we've got to do something about it right now. We have the opportunity. So let's talk about why. You know me, I'm always going to start with the food supply, right? Eat clean, move, sleep. Those are my big three. And I want to emphasize that even the MAHA report agrees that our food supply is safe, but that doesn't mean that our food supply is healthy. You know, there's a data analytics term that garbage in equals garbage out, right? And so if you put garbage data into a computer, you're going to get garbage data out that's not very reliable. Our bodies process nutrients like computers process data. And if you put garbage in, we're going to get garbage out. Again, where manufacturers only have to meet the GRAS standards generally regarded as safe, and we end up with 10,000 ingredients that manufacturers self-report as safe versus the Europeans who only have 400. Again, what does your brain, what does your gut tell you is right? Is it 400? Is it 10,000? Is it somewhere in between? We need to get a better grasp about what goes into our kitchen tables, onto our kitchen tables. And there's no question, there are scientific studies that go back decades that show a correlation between food dyes and hyperactivity and other neurobehavioral issues in children. So we've already started to peel back, at least on the petroleum-based, gas and oil-based, our petroleum-based food dyes, but we have a long way to go. That literally is the tip of the iceberg. So I'm going to go towards the third rail now and discuss vaccines. And understand, I am not anti-vax. Myself, my wife, our two kids have gotten all the vaccines that have been recommended by our doctors, the kids' pediatricians, our internists, and family docs. We even got COVID shots when COVID shots were required to go back to work and go back to school. So I'm not anti-vax, and only a fool would not acknowledge that vaccines have the ability to be life-saving and to eradicate disease. Smallpox was all but wiped off the face of the earth through a vaccine. Polio dropped dramatically to where it was rarely ever diagnosed because of a vaccine. So vaccines can save lives. The frightening part as a dad and as a doctor is that the number of vaccines has just grown exponentially. So let me give you a little historical perspective. When I was a kid growing up in the 60s, we had 5 to 7 shots to eradicate 5 different diseases. A baby born today, the schedule recommends 72 vaccines before the 18th birthday, and 27 of them should be administered before that baby turns 2. So I guess when it comes to vaccines, here's what I'm asking. This channel was founded to create, inspire, inform advocates. And as a parent or as a grandparent, I'm asking you to advocate for your kids. I want you to learn, I want you to read, I want you to explore. I really want you to own this. And I want you to be prepared to have conversations with your child's doctors. You know, are we really a homogenous citizenship here in the US? Are we so homogenous as a community in the US that one size fits all is the best way to approach vaccines? Or can we look at the science, look at the data, and decide based on the risk to our child and the benefit of the vaccine and make a tailored approach to how we're going to keep our kids safe? Now, of course, there's been a lot lately about the audacity or the veracity of science of these lab results, particularly around the COVID virus, right? That's where a lot of this kind of hit the fan, okay? So one of the things that Secretary Kennedy and Dr. Oz and Dr. McCary and Dr. Bhattacharya have all said over and over and over, they are committed to transparency, they are committed to a return to the scientific method, and there's an emphasis in scientific results that talks about the word reproducibility. In other words, if I do an experiment in my lab in Florida, a scientist in another part of the country or another part of the world should be able to take my experiment, run the experiment in her lab or his lab, and come up with similar, if not the same, results. That means that there's reproducibility. You can reproduce the results of my studies in somebody else's lab. And when you see that ability to reproduce the results, it endorses that the studies were done the right way. Okay? And that's part of scientific method that's been around for centuries. Okay? They are committed to returning to that, and they are committed to transparency. Whether the lab results are favorable or unfavorable, they're going to be sharing them. This is really an attempt to get lobbyists, special interests, political donors out of recommendations about how to keep our families safe. It's about the scientists and the doctors and the parents collectively making decisions about what's best for their kids. So, what can we as parents do? What can we as grandparents do? Number one, let's look at the food supply. Start reading labels. I want you to prioritize whole foods. I want you to prioritize unprocessed foods. Consider shopping locally versus buying in the grocery store whatever the factory farm delivered on their semi that morning, right? Real food should not be a chemistry experiment. It should come from a farm. Ideally, it should come from a source that doesn't over-rely on pesticides and additives, right? Again, McDonald's French fries in the US have 17 ingredients. McDonald's French fries in Europe have 4. What does your mind, what does your gut tell you? Which serving of fries would you rather have? Second, physical activity. Get them out the door. Get them out the door. Now, we talked last week that grown-ups like you and me, we need 150 minutes of moderate exercise each week. Kids need more. They need an hour a day. Get them out, get them running around. They can still have their screen time, but screen time can't be the only time, right? So get them out the door, get them running around, get them interacting with their friends. Get them interacting with people that they have conflict with, right? Because as they run into scrums on the field, they're learning to manage conflict with peers. That's a lifelong skill set. When they're interacting with their coaches, they're learning how to interact with authority figures. That's a lifelong skill set. Sleep hygiene, we need to set a firm bedtime, and we need to enforce that bedtime. And we need to give them the same opportunities for good sleep that you and I have. And that is, turn off your screen 1 to 2 hours before they go to bed. Dark room, quiet room, cool room. What works for them works for us. And finally, environmental awareness. We need to make sure that we put them in the safest environment. So, again, this can be harder because it's not in our direct control all the time. Some of it is. There was a really frightening article that came out about 3 weeks ago in one of the neurology journals that showed if you live on a golf course, there's a 30% increased risk that you will develop Parkinson's. Parkinson's disease is not a diagnosis that anyone wants. And yet, simply living on a golf course puts you at a 30% greater risk for developing it in your lifetime. Why is that? Think about a golf course. What's the first color that comes to mind? Green, right? Well, the grass and the shrubs didn't get that green all on their own. They're sprayed because they want to create a beautiful environment for the golfers who are enjoying their round of golf, right? Well, those pesticides and those additives all get into the ground. They nurture the grass and the bushes and the leaves, turn everything green. They then go deeper. At the end of the day, they get into the water table, the same water table that our homes share since we're right there. And as it gets into the water table, it becomes part of our house too. Our water supply, our exposure through our grass and our plants, right? So I'm not saying you have to sell your golf course home, but you need to be aware of it. And we need to have a similar awareness about places where our kids go. Their schools, their fields of play, if you are successful about getting them off the couch and off of screen time and out competing. So we need to try to make sure that our kids are in the healthy environments possible. So we need to be focused on food, getting them unprocessed food, getting them food that's intended to be food, not a chemistry experiment, and trying to reduce the number of pesticides and food dyes and additives that they're exposed to. We need to get them moving 60 minutes a day. We need to get them sleeping about 9 hours a day. And we need to create the healthiest environments possible in our homes, in their schools, in their outside activities, right? What we are doing today is failing our children. We can't reverse time, we must reverse course. And I want you to get engaged in the community. Have meaningful conversations with your kids' pediatricians. Have informed conversations and make decisions that are in your baby's best interest, not following some one-size-fits-all schedule. I want you to really step up and own this. Here's the thing. I want you to focus on your kids first. I want you to focus on your babies first. Create the safest bubble around them that you can as a parent or as a grandparent. And then I want you to start to advocate. And maybe you start at the school board or at the PTA meetings. Maybe you get involved at a city or a county level. At the end of the day, we need to be advocating at a state level if we're going to really make fundamental change. The good news is at a federal level, for the first time in a long time, we have a group of leaders who are willing to say the quiet part out loud, who are willing to look at real science and help us make informed decisions. I also want you to make sure that you're advocating for healthy food choices at your schools, because Lunchables is not the answer. Agree? Last thought. Everything that I just talked about, creating a safe and healthy environment for your kids, applies to us too. Like I said, I want you to focus on your kids first, but I also want you to focus on yourself as well. Because as I always say, you have to take care of yourself if we're going to be able to take care of others. I'll see you again soon.